Good afternoon, everybody. We'll get started in just about 2 minutes.
What?
You might want to mute your phones, everybody, just in advance. We'd like to make sure that everybody's on mute, and we'll get started in just another minute here. Everybody, I have 3:01, and so we're about to get started. My name is Heather Korbulik, and I'm the Executive Director of the Silver State Health Insurance Exchange. We appreciate you joining us today for our monthly presentation or meeting with brokers, agents, and exchange enrollment facilitators. Today is March 26th, and we're looking forward to giving you an update on our transition and the status of that transition. Wanted to just make sure that everybody is aware that we are recording this presentation and it will be posted to our website. There is a chat feature that's available for any questions, so if you want, you can chat with the group and make your message public or question public. Otherwise, you can chat directly to the host, and we will be working on making sure we get answers to your questions today. If we don't know the answers, we'll make sure to follow up with those answers to you in the next meeting and directly beforehand. So let's get started. And just one more time for people who are just joining, wanted to remind everybody that we are recording this presentation. Today we'd like to go over introductions of the staff from the Silver State Health Insurance Exchange / Nevada HealthLink who are on the call. I want to give you some updates on where we are with our project and this transition, give you some related information to the web page that we've created for enrollment partners, talk about what we're doing in order to establish training and modules for certification with Nevada HealthLink on and where we are with that. A little bit more about training timelines and certifications for our brokers and navigators. A little bit of Q&A from the questions that we received before this meeting, and then talk about how you can get in touch with us. Wanted to remind everybody again that we are able to answer questions today. So if something pops up during our conversation, please enter that into the chat box or to the chat feature, either privately or to the group, and we will work on getting a response to you. We would also really like and solicit your feedback for future meetings. We'd like to be able to use the questions that you have to develop future agenda items. So at the end of this meeting, I'll give you the contact information for our staff and myself if you want to suggest future agenda items or have questions that you'd like answered in the next meeting. A list of the Exchange staff who are on the call today. You've got myself, Heather Korbulik, the director. We have Ryan High here in my office. He's the Chief Operations Officer. Rosa Alejandre is on the phone. She's our navigator and program manager for Exchange enrollment facilitators. We also have Rebecca Lamazo, who is our broker liaison. Janelle Davis, who's our communications manager. Russell Cook, who's our information systems manager. Eric Watt, who is our project manager. And then Athena, who is our information technology analyst, who you were receiving invites and responding to these invites to. Let's talk about where we are with our transition. Right now, we are happy to announce that we have solidified and confirmed the methodology and platform by which we will be receiving the data from CMS. And when I'm talking about data here, I'm discussing the application and enrollment data that is for all Nevadans that are currently using healthcare.gov. That data will be migrated over to the Exchange or to the Get Insured platform, and we'll populate that system with all of those folks that are currently enrolled. And this will give us an opportunity to be able to automatically re-enroll consumers who are eligible for auto-enrollment, and then to solicit consumers who are not eligible to log back in or log into the Nevada HealthLink system and select a new plan. We do have confirmation from the Centers for Medicare and Medicaid Services that they will include NPN numbers. Natural producer numbers will be affiliated with applications. So when we receive this data migration, if your natural producer number is affiliated with one of those applications, it will also be transferred over. And the intent is that we will be able to, you will be able to log in and see your book of business to the extent that that book of business is accurately represented in healthcare.gov. So that should be migrated over to the Get Insured system, and you should be able to continue work on that platform as you would have from healthcare.gov. That data is coming to us in April for some testing, and then again in August with a final catch-up and completion in late October. We're also working closely with all sorts of stakeholders on an information and security plan. We are required to complete a suite of privacy and security measures to ensure that we can adequately protect Nevada consumers and demonstrate that we are able to do so at a state level. So we're working on finalizing this plan in order to get approval or authority to connect. And so this is a major milestone in our project, and we are on track to complete that in the time frame that we anticipated being able to do so. We're working closely with the Division of Welfare and Supportive Services to leverage their connection to the Federal Data Services Hub. Every state has one connection allocated to the state to basically ping out to the Federal Data Services Hub. And what you get, what's included in that is information from the IRS to confirm income. We can confirm residency by pinging to Homeland Security. We can check on Medicare status, TRICARE status, etc. So this is a very complicated portion of our transition integration, and we are happy to say that we do have an approved plan in place to connect our two systems. and we have started testing that this week. We also have gone through a series of operational readiness reviews with the Centers for Medicare and Medicaid Services. These are an opportunity for our vendor Get Insured and for the exchange to demonstrate that we have the mechanisms and the tools in place to operate a fully functional state-based exchange. On our last operational readiness review, we provided some information and demonstrated the single stream application and for both financial and non-financial applications. We've also really got a chance to demonstrate to CMS our intentions around account transfer workflows and how they will, account transfers will go back and forth between our division, the Silver State Health Insurance Exchange, or Nevada HealthLink, and the Division of Welfare and Supportive Services. We had positive comments from CMS and are looking forward to the next quarterly operational readiness and readiness review. We are working, like I mentioned earlier, we're working on our training and certification, and we're going to be providing a little bit more insight into that here in a few slides. And when I say training and certification, I'm referencing training and certification for brokers and enrollment professionals. I wanted to take a moment to remind everybody that we have set up this website at nevadahealthlink.com/partners-transition, and this is a website that you cannot navigate from the Nevada HealthLink's homepage. So it's exclusively being shared with our enrollment professionals. This is a definitive resource for you and anybody who is an exchange enrollment facilitator to view a schedule of our upcoming web meetings, to review slides from previous meetings, review slides and the recordings of previous meetings, along with being able to access reference materials. So in the near future, we'll be able to have our broker and EEF training guides available, along with user manuals on how to use the Get Insured state-based exchange platform. We're, like I said earlier, we're working on creating and developing a training that will be required for certification in order to gain access to the Get Insured system. All exchange enrollment facilitators, brokers, navigators will have to complete this training and will have an opportunity to not only complete training as it relates to helping consumers enroll, but also as it relates to using the Get Insured platform. So we anticipate that the bulk of this training will look very much like the one that you're completing or you have completed in years past with healthcare.gov, with some additional specific information related to how to use the Get Insured platform. We are working to accept or work with directly a vendor that will offer an online training module that will be interactive. It will allow for you to complete this training on your own time and pass the tests that will be associated with that training all in one place. We do anticipate allowing brokers and navigators to pass tests with an 80% result, and you will be allowed 3 chances to complete that. The exchange is going to expects to select that vendor here in the very near future, and we are working towards our goal date of July 2019 in order to have that training available for you. Oh, we have more information on this page. Here we go. So I apologize for saying all that stuff on the last slide, but really, let's see, what else are we working on? We are going to be communicating to every health and life licensed exchange enrollment facilitator and broker producer to let them know that this training is available, and that that communication should come out sometime in probably May or June. We'll also be offering an opportunity in-house to get trained by our staff, and those will likely happen in early July, both in our northern office and our southern office. But again, I'm placing emphasis on the fact that these trainings will be available in an online module, and you will not need to attend a training in person. These materials are going to be very much in line with what you're already doing, and we anticipate having this certification process happening in July and August. We'll be requiring brokers and agents to demonstrate that they have an active license with the Division of Insurance to successfully complete our online training and then agree to abide by the Exchange's Broker Code of Conduct. Do we have any questions before I go on? Okay. So a few questions that we got in advance of today's meeting. One was about whether the Get Insured platform will will work with other exchange type technologies or web broker enrollment technology like Quoted. And we appreciate that question and also appreciate that technology that exists. But do want to make sure everybody is clear that the only way to enroll Nevadans into Nevada HealthLink plans will be directly through the Get Insured platform. We're confident that the functionality of the Get Insured platform will offer not only similar experiences to these enrollment technologies that you may be using elsewhere, but also potentially some improvements over the healthcare.gov functionality. And specifically as it relates to the features for agents and brokers, today you'll be able to, or with the Get Insured package, you'll be able to establish agent account creation. An agent dashboard will be available to you. A robust book of business lookup tools will be available, along with the ability for brokers, agents to have consumers designate them as their preferred broker and agent, and then the ability to do kind of consumer impersonation shopping. So an agent or a broker will be able to shop for a consumer through the portal. Another question that was asked was, what happens to clients that called the Federal Exchange to enroll several years ago that may not have a username and password to log into the healthcare.gov website? How will these numbers be brought over to the state exchange, and how will I be able to see them since my NPN number is not on the healthcare.gov website? So to be clear, if your affiliation on healthcare.gov is not on the application, that affiliation will not be transferred over to the Get Insured platform. You'll be able to view all of the consumers that do indicate your NPN number on their application. However, any consumer that does not will need to log into the system and designate you as their broker or agent of preference. You will have the ability to search and filter your consumers through the broker enrollment or book of business tools. You'll be able to look at their application type, their names, their application status, next steps, any kind of pending required documentation that is necessary for that consumer you'll be able to see and filter into. Additionally, let me see. So essentially what we're saying is that if the NPN number is not affiliated with the application on healthcare.gov, you will need to have that consumer log in and basically add you as their preferred broker agent. Do we have any other new questions? Not any. I'm going to pause for just a minute and see if anybody wants to enter a question into our chat feature. And while I'm doing that, I would appreciate, again, any kind of feedback you have or requests that you all have in terms of what you'd like to learn at our next monthly meeting, along with any questions that you'd like us to research or have available to answer at the next meeting. No questions? Okay. If there's no questions, then I will just leave you with the contact information for the exchange. We've got Rosa Alejandre, who's our program manager for Navigators, our broker liaison, Rebecca. You're more than welcome to reach out to either of those two anytime with questions as it relates to our transition or any kind of technical support that you might need. And my contact is down at the bottom of that screen, and I'm happy to try to get you the answers to questions that you might have and make sure that we get those publicized through these meetings in the future. So thank you for joining us today, and we look forward to meeting and discussing our transition again next month.